So it's my privilege to welcome you to VegFest. This is the second year of the event. I think it's been a huge success. I don't know what the attendance numbers are, but they're huge. I saw a line of people getting here at the beginning of the day, so we're really thankful you're all here. We want to thank our presenting sponsors, Brightside Kitchen, A Well-Fed World, and Yelp of Iowa City. Events like this take a lot of time and money and resources to put together, and without their support, this event simply would not be possible, so thank you to all of them. We also want to acknowledge our supporting sponsors, Trumpet Blossom Cafe, Veg Fund, and New Pioneer Food Co-op, and all of our other sponsors and donors. Please take a look at the program guide. They're all listed there. Thank them either today by purchasing some of their stuff if they're here, otherwise use their businesses. Contact them and tell them that you're thankful for their support of this event. So we're very thankful, like I said, to all of our donors, big and small. There are a lot of people who've contributed small amounts of money or large amounts of money to make this possible, and of course we're very thankful. And now on to the main show. I'm very excited to welcome Dr. Sharon Collins. Dr. Sharon Collins is a plant-based physician from Cedar Rapids. We could have carpooled next year. She started following a totally plant-based diet 38 years ago, and she's been practicing functional and integrative medicine for 35 years. Dr. Collins has been consulting with adults and children since 2014 when she left her pediatric practice. She is appalled, and I love that word, she's appalled by the state of health of many adults, but not surprised based on their lifestyles. She now recognizes that if you want to promote health and reverse disease, you must make evidence-based nutritional decisions and stop cherry-picking research that agrees with what you want to eat. She challenges patients, and I'm assuming all of us, to live more purposefully disciplined lives in order to avoid the pitfalls that occur when people live without restraint and without intention. So thank you so much for being here, Dr. Collins, and we look forward to hearing from you about the many benefits of a plant-exclusive lifestyle. So without further ado, Dr. Collins.
Thanks, everyone. It's good to be here, and it's good to see a room full of people who are interested in plant-based living and health. I want to tell you how it all started for me. It was in 1959, and I was 8 years old at the time, and I was reading a Bible story about Daniel, Shadrach, Meshach, and Abednego. For those of you who know your Bible, know that these young men were taken from their country to Babylon, where they were going to be groomed to be leaders in the king's palace. All the Hebrew youths that came from Babylon had, and this is what the Bible says, no physical defect. They were handsome. They showed great aptitude for many ways of learning. They were well informed and quick to understand new facts. So the official that was there told them that they would have to eat what the king produced for them because that was going to make them the people that he wanted them to be. Shadrach, Meshach, Abednego, and Daniel said, well, we don't want to eat that food. We're not used to eating that food. If you could just give us the foods that we want, then that would be okay with us. And the officials said, oh no. If you look worse than the other men that are here, it'll be my neck. So you have to eat the king's food. And they said, well, just give us a test. Test us for 10 days. That's all we ask. Give us vegetables to eat and water to drink and see what we look like. And they did. He did. And at the end of 10 days, they looked healthier and better nourished than anybody who was partaking of the king's food. So they were allowed to continue eating, and they had a 3-year training time. And at the end of that, they were tested, and the Bible said that they were 10 times better than all of the people in the king's palace. So, 8-year-old. Well, good food makes you healthier, and good food makes you smarter. So at 8, I determined to eat good food. I had a mother, and my mother did not agree with my idea of what good food was, so I had to, work my way through. But it was 10 years from there that I became a vegetarian. When I left my mother's house, I became a vegetarian, and then about 35 years ago, I became a vegan. Now, Thomas Edison said, "The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease." That was 110 years ago. We are still not there yet, but our eyes are more open now because we clearly see the increased disability and disease in the United States. Now, there are a dramatic number of studies that have shown that it is what we put into our mouths that cause the disease that we have. The food that we eat, including addictive agents like cigarettes and alcohol. And at the end of this study, if you want to hear my story about the cigarettes, you ask me, because I will forget, okay? Doctors today are not trained to do what Thomas Edison told us that we would be doing. Physicians are trained to recognize and treat the symptoms of disease. They are trained to be more effective, be familiar with the most effective drugs to eradicate the manifested symptoms. And they are, and we, because of litigation, are educated to tell our patients about their disease, about the expected progression or regression, and the long-term prognosis. That means that traditional doctors wait until disease manifests before it is treated. And why? Because the pharmaceutical industry pretty much educates physicians. They do all the research about all the drugs and how they mitigate or make worse their diseases. So doctors, like many people here in this room, live and practice above the waterline. Okay? We ignore the cellular level. And we assume that if we don't have any symptoms, that there is nothing going on the cellular level, which is wrong, because the invisible is more important than what you can see. The body is extremely adaptable, and it adjusts in order to maintain homeostasis. That means that it maintains balance, and it doesn't completely collapse or start to collapse until there is an overwhelming sense of, I can't do this anymore. I'm tired. And then that is when you begin seeing symptoms, and that is when you begin having problems. That's when you go to the doctor, and that is where traditional medicine usually, typically begins. By the time illness develops, it is rather late in the disease process. Except in true emergencies, dietary and lifestyle changes must be the first line of therapy if and when illness develops. But I will tell you that it should be there before as a preventative, because what difference will it make if you catch something early but it's deadly? You might as well prevent it from happening. Because we generally wait until symptoms begin, we have a problem in our health in the United States. Nearly half of the U.S. Health burden is, well, I said that wrong. However, morbidity and chronic disability now account for nearly half of the U.S. health burdens, and improvements in population health in the United States have not kept pace with the other wealthy nations. Relative to our size in our wealth, the U.S. spends a disproportionate amount of money on health care, but our disease burden is higher than most other nations. Not only that, but in some people ages 45 to 54, mortality is actually going up. And look at the other nations, France, Germany, Canada, Sweden, all of the mortality is going down. Now, what does this look like? The US diet, doesn't it? And it's very colorful. But if you look at that, most of the colors are the packaging. Because you know that color is something that attracts people. And we are attracted to color. But most of the people, most of the food in the standard American diet, white, brown, yellow, and beige. And for some children in my practice, for years, those were the only colors that they ate. We have ignored what we know to be right, and we have abdicated our responsibility, given it to industries whose primary purpose is to what?
Make money.
Exactly, make money, not to nourish us. Now our food is nutrient depleted, and the standard American diet leads to the standard American disease. And those are just some of the diseases that we are dealing with right now. Now, I had in my young life greater than 10 years of nutrition education, and part of that reason was because I grew up in the Seventh-day Adventist Church. How many of you have heard of the Adventist Health Center? So when I was a young child, I grew up in the Seventh-day Adventist Church, where it was very, very important to focus on your diet and your health. And so when I was going to medical school, I was, yes, I'm going to get more of this. I'm going to learn how to help people help themselves and make their lives better. But every attempt to discuss nutrition and disease was like, stop. Diet doesn't have anything to do with health. I was told more than once. So I left. I didn't leave medical school. In my second year of medical school, I dually enrolled in the College of Human Nutrition and in the College of Human Medicine, because I thought, finally, I am going to be able to let them know and convince them that this is really, really very important. Well, I dually enrolled, and that was a grueling year. But I learned a lot. And one of the things that I learned was that I could have enough protein and it wouldn't be a problem. Now, how did I learn that? I had to do a study. All of us had to do studies in that. And I chose a study where to find out if I could maintain nitrogen balance on a starch diet. And so I chose bread, because I love bread. And I figured I could eat a few slices of bread. Well, I had to eat 10 to 12 slices of bread a day. And it had, and nothing that I ate could have more protein than the bread. So I did a multigrain bread, and 2 slices had 10 grams of protein. So that's why at 150 pounds at the time, I had to eat about 12 slices of bread a day. And the bread could not be made with milk, it couldn't have any eggs, it had to be pure flour. And so I had a lot of fruits and vegetables, some nuts, some legumes, and some seeds, but nothing could exceed the protein that I got from bread. And we measured nitrogen. Nitrogen is a part of the amino acids. And in order to make protein, you have to use all of those all that nitrogen together, and you couldn't spill any. So every stool, all my urine was collected and measured for nitrogen. And at the first month, I was not consistently in nitrogen balance. And so I was beginning to wonder, am I going to be able to make a complete protein? By the second month, I was consistently in nitrogen balance. Yes. So I found out personally that you do not have to have anything else but eat enough. You have to eat enough. And you had to have enough variety and you could have enough protein. So all of this stuff that we're getting today is hogwash. Because protein, as long as you get everything, you will have what you need. Now, to tell you the truth, I lost 10 pounds. And I wasn't overweight, but I lost 10 pounds eating more and eating mostly bread. Okay? So, no one asked me when I went back to school, no one asked me about what I was learning. Nobody cared. Because we were trained in that to only know how to manage disease. And that is what we do as physicians. We mop up, we wring out over here as the faucet is overflowing in the background. So I want you to know something. If you are depending on your physician to tell you how to prevent disease, you are wasting your time. Not because doctors don't go into medicine to help people. That is not the reason. All of us do. But that is not the way we're trained. That is your responsibility. Your responsibility is to turn on the faucet. And we're going to hopefully teach you how to do that. Prevention is always superior to pharmaceutical therapy. It is your responsibility and my responsibility to educate ourselves about what we can do to prevent disease from developing in the first place. But you want to know something? It is never too late to start eating well. A good diet can reverse many conditions, and T. Colin Campbell said that. It is time to look at what causes disease. Chronic inflammation is the underlying cause of almost all chronic diseases. And we're going to talk about some here. We can reverse cardiovascular disease. Dr. Dean Ornish took patients with advanced cardiovascular disease, put them on a plant-based diet, and in 1 year, their disease reversed. Now, I didn't say got better. What did I say? It reversed. That means they did not have it anymore. And their disease and their condition kept getting better and better for the next 5 years. The control group in that study kept getting worse. Their disease continued to progress despite good medical therapy. The C-reactive protein is a measure of inflammation. And people that were on vegan diets showed a 32% lower level of C-reactive protein than the people who were on the American Heart Association diet. The only thing, there are two things different between a vegan diet and the American Heart Association diet. One is dairy, low-fat dairy, and the other is skinless meat and fish. So what conclusion would you come to if you heard that? That dairy and meat and fish are what? Inflammatory. Another disease, inflammatory bowel disease. Findings from the epidemiological studies that are indicate that diets high in animal fat and low, high in animal fat and low in fruits and vegetables are the most common patterns associated with an increased risk of inflammatory bowel disease. And I'm talking about Crohn's disease and ulcerative colitis and diseases like that. They also found that omega-3s are very important to prevent inflammatory bowel disease, and vitamin D is also very important. Stress is just at a horrible level right now. I have never seen as much anxiety and depression as we're seeing now because of increased stress. This particular insurance company divided their staff into two groups. One group were given intense vegan education. They weren't given vegan food. They were given vegan education. The other group was given nothing, no education at all. At the end of, I think it was 12 weeks of this, the vegan group reported improvements in general health, physical functioning, mental health, vitality, and overall diet satisfaction compared with the control group. Their food costs were down. Of course, they can't find anything in some restaurants, but their food costs were down when they made the foods themselves. And they had a 40 to 46% decrease in health-related productivity impairment at work and in general, in their general lifestyle. That's pretty significant. Let's talk about type 2 diabetes. Major, growing public health problem that threatens and is overwhelming our medical services. And what they are finding is that no matter what medical therapy is used, what we have found is that diet and lifestyle therapies are the mainstay of treatment for type 2 diabetes. And it's the only thing that will help with sugar dysregulation. The vegetarian diet improves insulin resistance and oxidative, I'm running behind, aren't I? It improves insulin resistance and oxidative stress markers more than the conventional diet. And like I said, what's the difference between the conventional diet and most conventional diets and the vegan diet? Dairy and meat and fish, okay? This particular study took postmenopausal overweight women, and they told them they can eat as much vegetables and fruit and plants as they wanted, but they had to cut down on their fat. And what they found was that their C-reactive protein and other conventional markers went down with that diet. A calorically restricted diet, they tried that for 24 weeks, which you found out that you don't have to do. But they had these people not eat that much, and they lost quite a bit of weight, and they found that when their fat around their organs went down, the inflammatory markers also went down. I don't know if anybody has ever heard of Dr. Cousins. He wrote a book called, what was it? It was called Diabetes Can Be Cured. Diabetes Can Be Cured, and he has done a lot. And he takes people to his ranch in Arizona, and he puts them on a vegan diet, and miracles occur. This particular documentary, sorry, let's go back here. This particular documentary actually took people who were really having problems with their diabetes, and they found that those people ate more, they lost weight, they felt better, and they came off of or decreased their medication for type 2 diabetes. Now, one of the things we don't talk about is dietary fiber. How many of you talk about your food? No, we don't talk about it, and most people keep that, pretty quiet. But your poop should be about that long. Should be smooth. Should be non-painful. And every day. Okay? Most people don't talk about the fact that they don't go more than every 5 days. Yes. Oh, I had a patient who went every 10 days. When she told me that, my mouth just dropped open. Are you kidding me? And she didn't want to do what I said, you got to find yourself another doctor because I'm not going to put up with this. And she didn't find herself another doctor. She did do what I asked her to do, and she's a nutritionist today who is speaking about the right things that she needs to do. But anyway, dietary fiber is anti-inflammatory. When you take in more fiber, you decrease your inflammation. What did I say disease was based on? The underlying problem? Inflammation. Okay. This particular study found that on 25 grams of fiber a day, severe knee pain and or moderate knee pain went away. It's anti-inflammatory. And I think 25 grams is nothing. The people in Africa in the bush eat more than 50 grams of fiber a day. And that is pretty much what we should be eating. So increase your dietary fiber. All right, let's look at cancer. Now, cancer is not something that cannot be prevented. Okay, we get scared when we hear the word cancer, we go to the doctor, we even think that we have cancer. It is very scary because of what usually can happen with it. But we find that a whole foods, plant-based, healthy, not Cheerios and, but healthy diet can prevent the development of cancer, can reverse the progression of some cancers, and can make our bodies actually hostile to cancer developing in them. We'll look at a couple of them. We'll look at prostate and breast cancer. This is going to blow some of you away, and most of you have probably never heard of this. But a healthy diet and lifestyle can help reduce the risk of breast cancer, we said. Cutting down on dietary cholesterol. What did I say? What did I say? Cholesterol. Where do you find cholesterol? Dairy. Do you find it in plants? No. Okay. Cutting down on dietary cholesterol will improve cancer outcomes in breast cancer as well as ovarian and prostate cancer. The more eggs you eat, the higher the cancer risk. Daily consumption increases the aggressiveness of cancer coming back. And if the egg is fried, it doubles the risk of cancer. Consuming 5 eggs a week leads to significant risk of breast cancer. But it's not necessarily just the cholesterol. It's the oxidized cholesterol that is the culprit, because it breaks down into a compound called 27-hydroxycholesterol. And that one compound increases the proliferation of breast cancer. And they found that more aggressive tumors have higher levels of the enzyme that converts cholesterol into 27-hydroxycholesterol, which can fuel breast cancer growth. Now is the time to take steps to make it less likely to get breast cancer and other cancers in the first place. But you know what else they found? Vitamin D3 can decrease the levels of 27-hydroxycholesterol in the blood. So we need to keep our vitamin D levels between 45 and 80 nanograms per milliliter to improve our risk of breast cancer. What's that? We need to keep our vitamin D levels between 45 nanograms and 80 nanograms per milliliter in our blood, okay? Okay, so these are some of the things that I have found that in looking at all the studies that we need to, you may want to take a picture of this because I don't want to just read it to you. These are the things that help with cancer prevention. And I would add also fermented soy-rich foods because soy has gotten a really rotten name. But fermented soy is not bad and in fact can be helpful.
Can you go back to the one just before? Just for a second. Yeah, that one. Thank you.
All right.
Thank you.
Okay.
This is really good stuff, by the way.
What's that?
You're doing really good stuff right now.
Okay. All right. The other thing is avoid processed meats. Exercise regularly, and you know what? You don't need to run a marathon to exercise, you just need to move. Centenarians in the world that have lived long, long lives don't run marathons. They just move. They sit on the floor, they get up. They use the stairs, they walk long distances. That's what we need to do. What are we supposed to do? Dr. Esselstyn said that we need to establish an expert committee purged of industrial and political influence, totally based on science. If we have those people making our dietary rules, you know what? We would be in a good place. Now, as a vegan, there are certain things you must have. Vitamin B12, vitamin D3, and omega-3s. And moms that are pregnant need a lot of omegas to give their babies good brains, okay? But you can't get it from fish. And why is that? Why do you think? It's toxicity. Our waters are toxic. And 50 years ago, that may not be true, but today, it is definitely true. We have a lot of organic pollutants, a lot of mercury, lead, and cadmium, so all of the benefits that you would get from the omega-3s are mitigated by all the toxins that you take in if you use fish. Now, a lot of people told, I know for many years, that, oh, you can't get good omega-3, the long-chain fatty acids from the plants. So you have to get the preform from fish. That is no longer the truth. We don't need to do that. And we need to remember that we can. In fact, Juice Plus just came out, and other people have done this, but Juice Plus is the first one that's come up with a balanced omega-3 of plants. And they did a study, and every one of those people that were in the experimental group, their omega-3 indices were higher than the normal, than the optimal, or at the optimal level. So omega-3 is very important because our brains shrink as we get older, and our children have a lot of other problems, and if we can help them with their IQ and help them with learning and focus and concentration, that is what we really need to do. Oh, people go, you might as well shoot me right now. I'd rather be dead than eat like that. And that's because they haven't eaten the foods that they need to eat, because we all know that if you eat something good, your taste buds will change. Give it 10, 14, or 20 days and you will feel differently. Plus, after they're feeling better, guess what? They won't want to go back to the way they were eating before. And my last point is that it's time to take back and grow our own food. I believe that we need to be digging in the dirt, but the dirt is pretty toxic sometimes, above the pesticides, so get above the, above ground gardens, but get in the dirt, okay? And grow your own foods in the summer. Unfortunately, we live in Iowa, and Iowa is not very amenable to growing things for almost 7 months of the year, okay? So, get your own tower, put it inside your house and grow it there. My tower happens to be in our church school, and because I wanted the kids to have something to grow, but they now eat green things, okay? And they enjoy it along with the other foods that they're growing. So I have to get another tower to put in my house because that's going to stay at the school. But you know what? You can't force anybody to comprehend a message that they're not ready to receive. You can't badger it into them. You can't make them do anything. And that's okay. But you know what? People are drawn to people who are healthy and who are vibrant and who are happy and with no pain, right? Aren't you? So you don't have to say anything. Live your life. Eat well. Be healthy. And people will be coming up to you and asking, why? How? What? And then you get a chance to speak. Enjoy it.